Welcome, I'm Bethany Vanyo, one of the clinical training specialists. Today, I'm going to guide you through the assembly of your sprayer and discuss how to maintain and care for your sprayer in between uses. By the end of this video, you should have a good understanding of how to properly assemble and care for your high-resolution sprayer. Let's get started. First, let's remove all the contents from the packaging and identify each component. We will start with the sprayer. The sprayer is operated by battery power. Before we can use the sprayer, we must insert the 9-volt battery, which is provided in the contents kit. In order to insert the 9-volt battery, we must open the cover using the provided flathead screwdriver. To remove, it's best to place the sprayer on a solid, flat surface. Use the screwdriver to loosen the screw to the battery compartment. As you can see, the screw is located on the back of the sprayer, near the top of the handle shown here. Please note that when the screw is loosened, it does not need to be fully removed. Remove the battery compartment cover and insert the 9-volt battery. If you are replacing an existing battery, properly dispose of the battery and insert the new battery. Follow the markings for positive and negative orientation as shown here. Replace the battery cover compartment. Be sure to hold the sprayer unit upside down on a solid surface as you tighten the screw. To make screw alignment easier, push down the cover and hold it in place. Install the screw firmly, but do not over-tighten. Be careful not to cross-thread. If it is difficult to tighten the screw, it may not be aligned properly. It is best practice to always have a spare 9-volt battery in the office for times of need. You will also want to be mindful of noticing when the battery may be close to end of life. You may notice a difference in the battery power sound, or you may notice that it is no longer spraying as effectively as before. It's always best to replace the battery prior to its end of life. The battery should always be checked if you notice the sprayer is not functioning properly. Next, let's locate and insert the sprayer tip. Carefully insert the sprayer tip. Do not push the tip into the sprayer slot with excessive force. When the sprayer tip is properly in place, it should not be loose, but should be easy to remove. At this time, we will locate the scanning spray container. The scanning spray container screws into the sprayer body as shown here. When it's time to replace the scanning spray container, unscrew the container from the body. For good maintenance and care of the spray body, you want to ensure that you are properly cleaning the sprayer. During use, you may notice that there is a clog. To properly unclog, remove the sprayer tip and scanning spray container from the body. Locate and use the wire brushes that were provided in your contents kit. Insert the brush into the hole that holds the sprayer tip to first remove any clogs. Make sure to push the brush all the way until it stops. Next, use an air syringe, preferably the air syringe used in the lab or to clean a computer keyboard and not the air-water syringe, to blow air through the hole that holds the sprayer tip to remove any further spray residue. Lastly, use the wire brushes to clean out the internal surface of the sprayer tips or replace with a disinfected sprayer tip. Within your kit, you've been provided with 6 sprayer tips and 3 wire brushes. Being that the wire brushes are so small and can be easily lost, it is best practice to tie a string around the loop at the end of the brush and hang or place in a secure location within your sterilization or designated room. Holstering the sprayer on the cart. When not in use or between patients, the sprayer should be stored in the holster on the cart. If you do not own a cart and rather a tablet, you can choose to use an alternative holster, like a tall ceramic mug or the like. This will allow you to securely store your sprayer between uses. How to use the sprayer. The patient may be seated upright or supine to apply the scanning spray. Air dry the field. Position the spray tip approximately 2.5 centimeters or 1 inch above the surface of the tooth. Depress the trigger on the sprayer and move in continuous, smooth motion across the area. The trigger controls the flow rate, so the further you squeeze the trigger, the greater the flow of scanning spray. It is recommended you start with a light squeeze on the trigger. If you need to change the direction of spray, for example, to apply spray to a patient's upper arch, rotate the sprayer tip, not the device itself. Repeat as necessary to deposit a very thin, consistent layer of scanning spray on all sides and surfaces. If necessary, apply air to evenly distribute the scanning spray. When the trigger is not depressed, the scanning spray will not flow from the sprayer tip. To stop the flow of scanning spray, release the trigger. Between scans, make sure you maintain the proper coating of scanning spray. Check for the following: gaps in the scanning spray caused by the tongue, lips, or cheeks wiping it away, any obstructions of the scanning field caused by scanning spray clumps or the accumulation of fluids, or spots where the scanning spray pattern has worn off. This may happen most easily on cusps and occlusal surfaces. If any of the stated occurs, reapply the scanning spray. To avoid reduced performance and damage to the sprayer, only use high-resolution scanning spray. You will also want to avoid shaking or tapping the sprayer while a scanning spray container is attached, laying the sprayer on its side while the scanning spray container is attached, or turning the sprayer upside down while the scanning spray container is attached. Remember, to redirect the spray, rotate the sprayer tip. You want to avoid the aforementioned, as these could result in a clogged manifold, which could damage the sprayer. Let's go over some what-if troubleshooting tips. What if the sprayer is not working, or if the pump is not running? If this is the case, check the battery and replace if necessary. What if the scanning spray flow is low or has stopped? Check the level of scanning spray in the scanning spray container. If it is low, replace with a new container. What if the scanning spray is not coming out? Check to see if the sprayer tip is clogged. If it is, clean the tip with a wire brush. What if the scanning spray is clumping? Change to a new container of fresh scanning spray. What if the manifold is clogged? In this case, remove the sprayer tip and scanning spray container from the sprayer. Insert the brush into the hole that holds the sprayer tip to first remove any clogs. Then use an air syringe. Blow dry air through the sprayer body to clear any scanning spray clogging the manifold. You will also use the brushes to remove any excess scanning spray in the sprayer tip and/or replace with the new disinfected sprayer tip. What if you need to order more brushes? You can order them through your authorized dealer. What if you need to locate the lot number on the sprayer? You can find it by turning the sprayer upside down. The lot number should be located on the bottom of the sprayer. Now that you know how to care for and maintain your sprayer, let's discuss the cleaning and disinfection procedure for the sprayer. For the cleaning procedure of the sprayer, put on a pair of fresh gloves. Wipe down all surfaces with an intermediate level disinfectant, such as CaviWipes AF, CaviWipes, or the equivalent. When all surfaces have been wiped, discard of the wipe. The sprayer tip should be cleaned with the wire brush. It is important to note that you should clean the internal surface of the tip while dry. Once you have thoroughly cleaned the sprayer tip, run the tip through the ultrasonic. When complete, rinse under tap water and dry. For the disinfecting procedure of the sprayer, wipe down all surfaces with a new wipe. Allow for the recommended contact time per manufacturer. Allow a 3-minute contact time for CaviWipes and a 5-minute contact time for CaviWipes AF. Lastly, you will autoclave the sprayer tips in between each patient.